and welcome back, students. For today's lecture, we will be discussing about modules 6 to 8. So basically, tatlo na sama-sama siya, nag-merge. And this is about the pre-analytical phase or the pre-analysis of specimens in the laboratory. A few reminders before you start watching the video lecture. Number 1, of course, please do take down notes. A soft copy of the presentation has been added to your smart kits already. Listen attentively, avoid unnecessary distractions, and of course, give extra attention to information marked with a star because it may be a recall question in the board exam. So here are our learning objectives for today. Number 1 is to define key terms. So terminologies. Second is to identify patient variables including physical activity, circadian rhythm, diet, medications, age, sex, etc. that can affect test results. Third is explain the importance of proper collection and handling techniques of samples. These samples does not primarily include just the blood. It also includes other body fluids, which will be discussed later on. Okay, so the pre-analysis or the pre-analytical phase. But first, ma'am, ano po ba ang ibig sabihin pag sinabi nating pre-analytical phase? As mentioned in the previous chapters, meron tayong tatlong phases in the laboratories. We have the pre-analytical, we also have the analytical, at ang ating post-analytical phase. The pre-analytical phase actually encompasses this one. Itong area na ito. Dito papasok yung preparations and other variables na mangyayari before tayo pumasok sa analytical phase, which is the testing phase. So basically, lahat ng ginawa natin before natin i-test yung samples natin in the laboratory can be a part of the pre-analysis or pre-analytical phase. Katulad nga dito sa illustration na to, like dito nagsimula sa taas, dun sa ating physician, nag-request siya ng test, tapos, i-collect natin yung samples depending on the test. Doon tayo magbe-base kung anong samples na kailangan natin. It's either blood, urine, CSF, or other body fluids. And of course, the identification of the patient is very, very important in the pre-analytical phase. Kasi kung magkakamali tayo dito pa lang sa pre-analytical phase, of course, class, affected yung analytical at post-analytical phases natin. That's why it is said here that the highest frequency of errors with high risk for patients actually happens in the pre-analytical phase po. Okay? Kasi nga po, kapag dito pa lang sa pre-analytical phase, nagkamali tayo ng sa isang bagay, pwede na natin maapektuhan lahat ng phases na pagdadaanan natin with regards to the testing of the samples. At dito rin papasok nga daw yung high risk for the patients kasi what if, a good example, mali yung pasyente na nakuhanan natin. Tapos yung nakuhanan natin na pasyente ay may sakit. Mami-misdiagnose ngayon yung pasyente natin kasi maling test results yung ibibigay natin sa doktor. That's why it is vital that the pre-analytical phase is known to medical technologists as well as anong mga variables ba ang nakaka-affect sa pre-analytical phase natin. Okay? So, definition of terms. So, itong mga terminologies na ito, maririnig nyo siya all throughout the duration of this topic. So, please do take note of this. Number 1 is an anticoagulant. This is a tube additive that prevents blood clotting. Yung coagulant nga kasi, ang ibig sabihin ng coagulant is yung blood clotting po, pamumuo ng dugo. Kapag pinagsama anti tsaka coagulant, pinipigilan niya ngayon blood clotting or it prevents blood clotting. That is the anticoagulants. This anticoagulants again is being added into the blood tube. So, mga tube additives po ito para hindi daw po mag-clot yung blood natin. Because normally, when we collect blood, after a few minutes, pwede na pong mag-clot yan. Okay? Outside the body. Kapag walang anticoagulant, ang blood na kinuha mo, most probably, magkaklat po yan. So, meron tayong mga test kasi na hindi natin gusto ang may blood clots. Okay? So, ang gagawin natin doon para sa mga test na yon para hindi mag-clot is gamit tayo ng mga tube, mga blood collection tubes na may anticoagulant. Also, basal state. Basal state refers to the resting metabolic state of the body early in the morning after fasting for a minimum of 12 hours. That's why kapag ang tinanong po sa inyo, what is the basal state collection? That is collection of blood early in the morning after awakening after a period of fasting. Then again, the fasting requirement here is minimum of 12 hours. Ang fasting class, ang ibig sabihin niyan is walang kakainin at iinumin within this time period. Okay? Yung fasting po natin, merong mga different times or hours yan eh. So, depending on the test, kung ano ang kailangan nating i-test. But for basal state collection, pag ganun yung nabasa nyo, that is, again, early in the morning, after awakening, after a period of fasting for a minimum of 12 hours. Okay, third one here, we have the clot activators. Clot activators are also tube additives, just the same with your anticoagulants. However, nandun na yung term clot activator, it accelerates clotting. So, kung ating mga anticoagulant prevents blood clotting, ang clot activator naman, pinapabilis niya ngayon yung clotting natin. Yung clotting kasi ng blood clots, it takes a few minutes before it happens. And inside the laboratory, most of the time, we are fast-paced. Gusto natin, mabilis natin maibabato yung result sa mga doctors natin, especially kung emergency yon. So, hindi natin kaya magantay ng sobra-sobrang tagal bago mag-clot yung blood. So, what we can do is, you need to use a blood collection tube that contains a clot activator para po mas mapabilis yung blood clotting natin, mas mabilis nating ma-itetest yung sample natin ngayon. Kung ganun yung requirement ng ating analyte. We also have the term diurnal variation. These are normal daily fluctuations in body chemistry related to hormonal cycles, sleep-wake cycles, and other regular patterns of change. Si diurnal variation naman, this is something to do with yung fluctuation ng analytes inside our body. Ang nangyayari po kasi, tayong mga medtech, tinetest natin yung different analytes to check if mataas or mababa siya. At si doktor ngayon, ang gagawin niya, ibe-base niya yung taas or baba ng analyte kung merong sakit yung patient. Kumbaga yun yung magiging basis niya. However, class, there are certain analytes that has a normal daily fluctuation, meaning, meron pong specific na oras na, itong analyte na to mababa siya, or mataas siya within this specific time period. That is diurnal variation. Again, that is normal daily fluctuations. Hindi ibig sabihin na mataas or mababa ang isang analyte, may sakit ka na. Okay, hindi po ganun ha with regards to diurnal variation, because then again, the diurnal variation is the normal pong nangyayari yan, daily fluctuations of body chemistry or analytes, and it is related lang naman to our hormonal cycles as well as the sleep-wake cycles and other regular patterns of change that happens inside our body all throughout the day. Okay, we also have the term here, hemolysis. Hemolysis means rupture or destruction of red blood cells. Ang hemolysis class, madalas ang mangyayari dito is from here, kung napapansin nyo tong picture na ito, this is the normal na itsura ng blood natin kapag nagsettle na yung red cell sa baba. At itong nasa taas is either plasma or serum. However, if in any case that your blood sample has been hemolyzed or meron nga pong hemolysis, nagkaroon daw po ng rupture or destruction ng red cells. What can happen is, instead na ganito, malinaw yung nandito sa taas, tapos nasa baba lahat ng red cell, ang nangyayari since nag-rupture siya or nagkaroon ng destruction ng red cell, yung red cells natin ngayon, umaakyat niya siya ngayon sa plasma or serum. That is hemolysis. Then, what about naman pag sinabi natin ay icteric yung sample? Once you are defining an icteric sample, it is used to describe a serum or plasma that is bright yellow to dark yellow in color due to excess bilirubin po. Okay? Ang normal color po ng ating serum or plasma is somehow light yellow tas clear. What can happen in icteric specimens is almost neon yellow na nga ang itsura. Kung makakakita talaga kayo, class, ng ating mga icteric specimens in the laboratory, as in, kulay bright yellow or dark yellow siya, or parang neon yellow na nga ang itsura niya. And then again, this is due to the presence of excess bilirubin po. Bilirubin comes from the liver. So, baka naririnig nyo na yung mga terms na hepatitis. So, yung hepatitis po is inflammation of the liver at ang isa sa manifestation ng hepatitis is yung excess bilirubin, which can be seen in the serum na icteric po. Okay, again, I repeat, pag sinabi po nating icteric, these are serum or plasma samples that is bright to dark yellow in color. So, ito kasing kay hemolysis, parang mapula siya. But in the icteric specimens po, ang serum or plasma natin is bright to dark yellow, almost neon yellow in color. And then again, this is due to excess bilirubin po. Also, we have lipemic samples. Lipemic samples, a turbidity of the serum or plasma sample caused by increase in lipids. Lipids po is fats, yung taba, specifically the lipoprotein chylomicrons. So, ito po, itong itsura niya na nasa baba, pakitingnan po ito. Okay. So, this one, ito pong parang taba na to, kapag kayo po ay nagsettle ng blood natin, tas maghihiwala yung mga components ni blood, ganito po ang pwedeng maging itsura ng lipemic sample after centrifugation. Magkakaroon talaga is in parang itsura niya para siyang taba. At ang main composition po ng mga chyme na ito is chylomicrons. Ayan. Again, lipemic samples are those samples which has increased amounts of lipids. And specifically, the lipoprotein na main contributor dito sa ganitong samples is chylomicrons. So, ito pa. Ayan. Yan o, kung makikita nyo, malabo. There is a turbidity in the serum or plasma. Dapat kasi, again, light yellow, tas clear lang po ang itsura niya. Almost parang tubig yung consistency. But if the sample is lipemic, makikita nyo talaga, class, na parang may sebo. Parang ganun na nga itsura nito in person. Parang na siyang may sebo, tapos turbid siya, malabo yung itsura ng ating serum or plasma. Tas minsan pa nga, makakakuha kayo talaga ng ganitong parang fat layer. At chylomicrons po ang main composition niya. Okay, we also have the term here, hemoconcentration, a decrease in plasma or serum volume which causes a simultaneous increase in the concentration of red blood cells and other commonly tested constituents of the blood. Pag sinabi kasi nating hemoconcentration, mataas daw po yung concentration ng red blood cells natin and other commonly tested constituents of the blood such as white blood cells and platelets. Ganito po yan. Ito po ang itsura ng normal na blood composition. We have here 45% is yung formed elements such as the red blood cell, tapos yung buffy coat composed of the white blood cells and the platelets, at yung plasma is the liquid portion of the blood. So almost 50-50 siya, tama? Ayan. What happens in hemoconcentration is onti ngayon yung plasma. A good example of a condition exhibiting hemoconcentration is polycythemia vera. Ito po, tingin dito. Polycythemia, that is a condition na merong hemoconcentration. If you will be comparing the normal ratio of the formed elements to the plasma or the serum, dito po sa normal, almost 50-50 siya, right? But in hemoconcentration such as polycythemia vera, mas onti po ngayon yung plasma or serum volume natin. Because the reason for that, hindi naman dahil konti talaga siya. Kumonti siya, yung itsura niya kumonti is because madami pong formed elements. Such as red blood cell, white blood cell, platelets. I repeat, pag sinabi po nating hemoconcentration, this is a decrease in plasma or serum volume. Itong part na ito, umonti siya. It's not necessarily na onti talaga yung volume niya. Umonti lang siya tignan because marami pong formed elements na napunta dito sa baba. Okay? So that is hemoconcentration. Next, we have Also, kung meron tayong hemo concentration, we also have hemodilution. Hemodilution is a decreased concentration of cells and commonly tested constituents in the blood, resulting in a gain of plasma or serum. So, ito naman po kay hemodilution, baliktad naman. Tingin dito, ito, di ba, 50-50. 50% formed elements, 50% plasma or serum. In hemodilution, such as anemia, onti daw po ngayon yung formed elements natin. Ito, onti lang. That's why yung ating plasma or serum is malaki po yung volume niya. Okay, again, ulitin natin. Hemodilution is a decrease in concentration of cells. Onti daw yung cells, itong kulay pula, onti siya. At dahil konti po yung formed elements natin, yung plasma or serum natin ngayon is madami ngayon. That is hemodilution. Okay. Next natin dito is our turnaround time. This is the amount of time to complete a whole process. This is from the pre-analysis to the post-analysis phase. Yung turnaround time, ito yung oras or specific time frame na dapat yung resulta ay maibalik na natin sa ating patients or doctors. Please do take note that the turnaround time is a part of the post-analytical phase. Please take note this is a recall question in the board exam. I repeat, turnaround time is what part of the phases that is post-analytical phase. I repeat, turnaround time is a part of the post-analytical phase. Recall question po yan sa board exam. Turnaround time. Ito yung time na dapat within this time period na ibato na natin or na ibalik na natin yung results sa patients or doctors natin. Dapat siguro sabihin natin pwede, ay dapat isang oras na ilabas na natin yung resulta. That is the turnaround time. Okay, so ito yung mga itsura ng mga pinagsasabi natin kanina. Again, this is the normal. Yung normal, right, parang light yellow, tas clear. Yung hemolytic natin, due to hemolysis, yung rupture ng red blood cells, di ba yung mga red cells na nandito sa baba, umangat siya ngayon kasi sira-sira na siya. Then, mapula ang itsura ng serum or plasma na merong hemolysis. What about the ecteric specimens? Yun yung bright to dark yellow or almost neon yellow, and this is due to the presence of excess bilirubin. At yung lipemic samples natin, ito yung turbid, tapos parang may fats, ganyan mga fat layer, and this is due to the presence mainly of chylomicrons. Okay, pre-collection variables. First is we have the diurnal variation. As mentioned kanina, this is the normal body fluctuations of body chemistry or analytes. So, pwede kasi mangyari like during a specific time, normal na mababa itong analytes na ito or normal na mataas siya. At ito po yung mga analytes na decreased in the afternoon or night. At ito yung mga analytes na increase in the afternoon, okay? So again ha, ang diurnal variation po is normal body fluctuations. Okay? Normal po na mababa ito or mataas within the specific time of the day. Okay. So first is, what are the analytes that is decreased in the afternoon or night? We have kapay. I repeat, diurnal variation decreased in the afternoon or night. We have kapay. Kapay as in our cortisol, ACTH, plasma renin, aldosterone, and insulin. I repeat, what are the analytes that is normally decreased in the afternoon or night? We have cortisol, ACTH, plasma renin, aldosterone, insulin. Yan, take down notes mo yan ngayon. Again, decreased in the afternoon or night, kapay. Kapay as in cortisol, ACTH, plasma renin, aldosterone, and insulin. Okay, what about those analytes that is normally increased during the afternoon? We have PTAG. PTAG as in PTH or the parathyroid hormone. TSH as in thyroid stimulating hormone. ACP is acid phosphatase. And the G is the growth hormone or the GH. I repeat, what are the different analytes that is increased during the afternoon? We have PTAG. PTAG is PTH, TSH, ACP, and GH or the growth hormone. So, kung kayo nung bata kayo, sinasabi sa atin ng parents natin or ng mga lolo or lola natin, matulog ka daw, 'di ba? Sinasabi nila matulog kayo sa hapon para tumangkad kayo. So, actually class, yung term na ganon, yung sinasabi sa atin ng matatanda ng mga bata pa tayo na matulog tayo sa hapon para tumangkad tayo, is actually, meron pong scientific basis yon. Okay. So, ano yung scientific basis nun, ma'am? Bakit tama yung sinasabi sa atin ng mga parents natin or mga lolo-lola natin na kapag sa hapon matulog ako para daw tumangkad tayo? As mentioned here, in the afternoon, so sa hapon, in the afternoon, the growth hormone is actually increased. Okay? At hindi lang po ito yon. Ang isa pa is ang ating growth hormone is actually stimulated during deep sleep. So, habang natutulog ka sa hapon, mataas po yung growth hormone natin. The growth hormone is responsible for our height. Okay? Kaya nga siya growth hormone. Yun yung hormone po sa katawan natin that stimulates growth. Okay? Kaya growth hormone yung pangalan niya. So, si growth hormone is actually stimulated, again, it is increased during the afternoon and in deep sleep. That's why tama yung mga matatanda dati kapag sinasabi sa ating, uy, matulog ka sa hapon para tumangkad ka. At may scientific basis nga yun. At yun nga yung sinabi ni ma'am. So, siguro sa atin, aside sa genetics, kung meron sa ating hindi ganong nabiyayaan ng height, baka hindi tayo natutulog sa hapon. Diba? What if is sa family mo, ikaw lang yung medyo hindi binayaan ng height. O, ayun, baka yun yung isa sa reasons. Kasi nung tuwing hapon, hindi ka natutulog. Yun kasi, yung growth hormone po talaga is actually stimulated or released during deep sleep at again, it is increased in the afternoon. So, ayan ha, kabisaduhin po ha ang mga analytes that is decreased and increased during the afternoon or night. Ayan na, si Kapay, tsaka si Pitag. Okay, common fasting specimens. Again, class ha, pag sinabi nating fasting is, ito yung specific time na hindi ka kakain or iinom ng tubig. Okay, so for fasting blood glucose, yung FBS na tinatawag, this is for diabetes po. Blood glucose is blood sugar. So, fasting blood glucose, ang kaniyang fasting time is 6 to 8 hours. So, dapat within 6 to 8 hours before collection ng blood, hindi po kakain or iinom ng tubig yung ating pasyente. Lipid profile. Lipid profile such as triglyceride, cholesterol, HDL, and LDL, and VLDL. Ito pong limang to, ito po yung lipid profile natin na analytes. 12 to 14 hours po ang fasting requirement niyan. Okay? And then, what if naman, ito madalas to sa laboratory class, what if ang request po sa inyo is fasting blood glucose tsaka lipid profile, pag pinagsama yan, ang fasting requirement na lang yan is 10 to 12 hours only. And then, for total cholesterol, ito class, don't be confused. Pag ang tinanong po sa inyo is total cholesterol only, no fasting required po ang total cholesterol natin, okay? Baka kasi malito kayo. Dito kasi sa lipid profile class, merong chole or cholesterol dyan. So, 12 to 14 hours. However, ang tinutukoy po kasi dito sa 12 to 14 hours is itong 5, lipid profile po, pag pinagsama-sama yan. Madalas, nire-request yan ng doktor, itong combination ng lipid profile, itong 5. So, 12 to 14 hours. However po, kapag ang nirequest sa inyo is total cholesterol only, pag total chole lang ang nirequest sa inyo, no fasting requirement po ang total chole. Pag ito lang. Pero kung kasama niya yung triglyceride, yung TAG, yung HDL, LDL, tsaka VLDL, 12 to 14 hours yan. Kasi that is the lipid profile. And please do take note of this, yung TAG is triglyceride. Ito po yung name niya, ito yung TAG, triglyceride yan. At yung HDL, yung high density lipoprotein is known as the good cholesterol. At yung LDL po natin is the low density lipoprotein, which is the bad cholesterol. So knowing this na si HDL ay good cholesterol at si LDL ay bad cholesterol, question ko sa inyo, ang HDL ba, maganda ba siya na mataas or mababa? Knowing na good cholesterol siya. Okay, comprehend lang natin. Diba, si high density lipoprotein or HDL is the good cholesterol. Ang question sa inyo ni ma'am ngayon is, mas maganda bang mababa or mataas ang HDL? Okay, so the answer to that, class, is ang HDL or the good cholesterol, knowing na good cholesterol siya, of course, class, dapat or mas maganda pong mataas po ang HDL sa katawan natin. Okay? Kasi siya yung good cholesterol. Then, yung low density lipoprotein or the bad cholesterol, of course, mas maganda pong mas mababa to sa katawan natin. Kasi nga bad siya. But the HDL, good cholesterol, since it is a good cholesterol, it is vital na mataas po ang HDL levels ng ating katawan. Okay, so here are the different factors aside dun sa mga na-mention natin, at ito po yung mga examples of the analytes that are being affected. So, we are also having here the age. Ito yung pwedeng maapektuhan yan, albumin, ALP, phosphorus, and cholesterol. Yung gender, male and female actually have somehow a little bit different normal values when it comes to analytes. Kasi meron pong mga analytes na normally mataas sa mga males, or normally mas mababa sa females. So may mga ganun po. Ito po yung mga examples niya. Of course, yung diurnal variation, huwag niyong kalimutan. Paki-memorize yung si Kapay tsaka si Pitag. Then, recent food ingestion, of course, kapag bagong kain, merong mga tataas na analytes yan. Posture, when increased standing, like matagal na kayong nakatayo, there can be an increase in the albumin, cholesterol, aldosterone, and calcium. Then, during activities, ayan po, and also stress. So, lahat tayo nakaharap sa stress. At yung stress is actually a factor on why some analytes is actually being increased, such as ACTH, cortisol, and our catecholamines. Kaya nga pag stress tayo, madalas parang magkakasakit tayo, di ba? Nakaka-affect po talaga ang stress with regards to the analytes. Hindi lang siya basta parang mentally. It can actually affect our physical body. Okay? So, yan po ang mga different examples. This is included in your modules. Pakibasa na lang po yan isa-isa. Then, these are the other analytes that is being affected by diurnal variation, posture, tsaka stress nga po. Again, minention naman na natin, di ba, yung mga diurnal variation. And then, ayan. Meron tayo dito yung thyroxine, which is increased during exercise, and prolactin. Prolactin is something to do with yung production ng milk ng mga mommies, and then iron and calcium is actually being affected by these variables as well. Okay, hemolysis. Moving on. Hemolysis. Hemolysis, di ba, yung rupture ng red blood cell. Pag nakakita nga po kayo ng sample na hemolyzed siya or may hemolysis, ganito nga po ang itsura niyan. Instead of light yellow, naging kulay pula. What are the possible causes of hemolysis? Number 1, a needle that is too small. So, marami ka palang kailangan na blood, tas yung needle na ginamit mo is masyadong maliit. So, that can cause hemolysis or that can procure hemolyzed samples. Next, pulling a syringe plunger back too fast. Masyadong nagmamadali. Yung plunger ng syringe, yung inaangat, masyadong mabilis mag-angat kasi nagmamadali. So, that can also cause hemolysis. Next, expelling the blood vigorously into a tube. Meron pong proper way on how to expel the blood in the tube. Tuturo ko yan sa inyo kapag nandun na tayo sa venipuncture. But hindi po yan dapat parang gigil na gigil maglagay ng dugo doon sa blood tube natin. That can actually cause hemolysis as well. Number 4, shaking or mixing the tubes vigorously. Shinake ng maigi, akala niya french fries or shake. As in, shinake niya ng shinake, hindi po ganon. Meron pong proper mixing of our blood tubes. Papakita natin yan mamaya. Fifth one, performing blood collection before the alcohol has dried at the collection site. Dapat po, kapag kayo ay magko-collect ng blood, once na i-disinfect nyo siya ng alcohol, hihintayin nyo po muna siyang mag-dry. Okay? Si alcohol kasi, di ba, pag nilagay nyo yan sa skin, hindi naman yan agad-agad magda-dry. So, iintayin po muna natin siyang mag-dry bago natin mag-perform ng blood collection because, as mentioned here, the alcohol, aside from being a contaminant in the blood sample, it can actually cause also hemolysis. At ayaw na ayaw po natin mga hemolyzed na sample. Okay? Madalas class sa laboratory, kapag hemolyzed ang sample nyo, ipapa-repeat collection yan agad-agad. Sobrang dami pong analytes that is being affected ng hemolysis. Okay? Pag hemolyzed ang sample, almost automatically, kahit anong test yan, ipare-repeat collection yan sa atin. Kasi marami pong analytes ang nagiging affected with hemolysis. Lalo na yung mga basic test natin, affected sila sa hemolysis. So, ito nga mga good example of the analytes affected by hemolysis. So, we have here si PMLS. Ayan, kabisaduhin ha. Again, what are the different analytes affected by hemolysis? We have PMLS. We have here si phosphate, letter P, phosphate. M is magnesium. We also have here ammonia. ALT, alanine aminotransferase. We also have AST, ACP, LDH or the lactate dehydrogenase. Iron is also affected. Catecholamines, CK or the creatine kinase. At kalimutan nyo na ang lahat, wag lang po si potassium or yung K. Yung K, di ba, yun yung representation ng element na potassium. So, si PMLS, ayan, these are the different analytes that is being affected by hemolysis. Kalimutan nyo na lahat, makalimutan nyo na itong lahat ng to, wag nyo lang pong kakalimutan yung potassium class. This potassium is heavily affected by hemolysis. Kaya po, hindi talaga acceptable ang hemolyzed sample in the laboratory. Also, aside from the PMLS na yan, please also take note that HbA1c, total protein, albumin, cholesterol, bilirubin, insulin, triglyceride, and ALP is affected by hemolysis. Ayan, di ba? Ang dami. So, sa sobrang daming analytes na affected ng hemolysis, almost automatically, pag hemolyzed ang sample, rejected yan agad sa laboratory. Okay? So, ayan ha. Again, si PMLS, lalo na yung letter K, si potassium. And of course, huwag niyong kalilimutan itong mga nasa baba, si HbA1c, total protein, albumin, chole, bilirubin, insulin, tag, at si ALP are affected by hemolysis. Okay, so si potassium, represented by the red dots. This one. Itong mga nasa loob. Potassium is actually known as the major intracellular cation. It means nasa loob siya ng cell. Intra kasi, intracellular cation. When the cell membrane is ruptured, just like what happens in hemolysis, di ba nagra-rupture yung red cell natin? This analyte located inside out of the cell moved out to the plasma, thus increasing plasma potassium concentration. That's why hindi po talaga advisable ang ating mga hemolyzed na sample. Kasi dapat itong ating potassium, which is the major intracellular cation, nandito siya sa loob. Okay? Once this plasma membrane ruptures, like masira yan, lalabas ngayon yung ating potassium dito sa plasma. At once that happens, mag-i-increase po yung plasma potassium concentration natin. Erroneous na yung result. Okay, next here we have specimen collection. In collection, ensure the following. Number 1 is of course proper patient identification. So, make sure that the patient states his or her name and date of birth. Dapat sa kanila nyo po maririnig. Hindi po pwede class na kayo yung magsasabi, kayo po ba si ganito-ganito? Dapat po, make sure na, aside sa, tatanungin nyo of course, ano pangalan nila, pwede nyo rin sila class at ito yung advisable talaga, sila po dapat yung magsasabi ng name at date of birth nila. Okay? Then also complete labeling of the specimen. Dapat lahat ng tamang labels, na discuss na yan in the previous modules. Dapat po complete labeling yung specimen natin, lalong-lalo na yung name at date of birth ng ating pasyente. Also, patient consent and privacy is vital in specimen collection. Bawal po nating pilitin yung pasyente kung ayaw talaga nila magpa-collect ng specimen nila or ng blood samples nila or kung ano mang body fluids. Dapat meron po laging consent ang ating mga pasyente. And of course, yung privacy nila should be protected. And also in collection or specimen collection, to follow chain of custody for those tests that require COC. And these are the following. So we have here HIV, drug testing, nucleic acid test, networking test, and send-out test. These are the tests that requires chain of custody or COC. Meron pong medyo kakaibang way para mag-collect sa mga samples na ito. Yun po yung chain of custody. Time of collection. Sometimes sample have to be collected at a specific time. As mentioned earlier, meron po tayong mga analytes that is having diurnal variation. Okay, so with that, dapat within specific time period natin, i-collect yung mga samples na ito. Kung meron silang diurnal variation, as well as what if meron siyang fasting requirement. So, yung samples talaga natin should have a specific time to be collected. Hindi po lahat ay pwede kahit anong oras. Although, meron namang mga test na kahit anong oras pwede nyong kunin. But, meron pong mga specific analytes or tests na should be collected only at a specific time. Yan. Sabi pa nga dito, failure to follow the planned time schedule can lead to erroneous results and misinterpretation of a patient's condition. What if nasa diurnal variation lang pala yung sample nyo? Diba? Normal fluctuation yun. Mami-misinterpret yun ng doktor na mababa or mataas. Pwedeng ma-misdiagnose yung patient natin. That's why, kapag ang isang sample or isang analyte should be collected within a specific time period only, dapat dun ka lang magko-collect. Also, ASAP in a request form means as soon as possible and have to be prioritized. STAT or means immediately. Stat specimens are given the highest priority. So, sa laboratory class, hindi naman po lahat ng marireceive natin ay stat. Okay? Or ASAP, yung kanilang category. But what if nagsabay dyan is stat tsaka routine. Routine test lang. Of course, kailangan yung unahin yung stat specimens. Okay? Then, time specimens are ordered for monitoring purposes. Specimen rejection. So, ano yung mga criteria na pwede nating gawing basis bago po natin i-reject ang isang sample for repeat collection? Okay. Number 1, we have hemolysis or lipemia. Ayan o, number 1 talaga si hemolysis class. Most of the time talaga, once a sample is hemolyzed, yung blood nyo, hemolyzed, dinala nyo sa laboratory, most of the time, rejected po yan agad-agad. Okay, kasi nga 'di ba maraming analytes ang affected niyan. So, unang-una si hemolysis at si lipemia can be a basis for specimen rejection. Also, what if a clot is present in an anticoagulated specimen? So, 'di ba si anticoagulants is used to prevent blood clotting? What if may clot doon? So, ibig sabihin may mali kang nagawa doon sa sample na 'yon kaya siya nag-clot. Kahit may anticoagulant dapat. So, rejected po yan agad. Also, non-fasting specimen when test requires fasting. So, what if ang kailangan is fasting specimen katulad ng fasting blood glucose, 6 to 8 hours, dapat walang kakainin or iinumin. However, si patient ay hindi mo na-instruct na mag-fasting siya the day before. So, non-fasting yon, kumain siya nung umaga, tas kukuhanan mo siya agad for blood glucose. That is not correct. Magkakaroon po ng erroneous result doon. Baka lumabas ang taas ng sugar niya, kahit hindi naman talaga. So, non-fasting specimen should be rejected when test requires fasting. Also, improper blood collection tube. Kapag mali po yung blood collection tube na ginamit nyo, mamaya di-discuss natin yan isa-isa. Meron po tayong iba't ibang blood collection tube at each of those has a corresponding test na pwede. So, what if mali kang blood collection tube na na-collect? Specimen rejection po yan. Also, short draw or wrong volume, like kulang yung sample na nakuha nyo, like kulang yung blood na nakuha nyo para dun sa blood collection tube, it should be rejected kapag kulang or wrong volume. Also, improper transport conditions. There are certain analytes that should be chilled or kailangan nakayelo bago nyo dadalhin sa laboratory. Ang nagawa nyo is nakalimutan, hindi nalagay sa yelo or sa ice. So, that can be an indication for specimen rejection as well. 7 is the discrepancies between the requisition and the specimen label. Ang nakalagay kunwari sa specimen, sa requisition form nyo, ibang pangalan, ibang pasyente. Tas yung specimen na pinasa nyo ay iba rin yung label. So, discrepancy na yon. That is an indication for specimen rejection. Also, unlabeled or mislabeled specimen should be rejected immediately. Kapag walang label or mali yung label, class, rejected na po yan agad-agad in the laboratory. Also, contaminated specimen or leaking containers should also be rejected once you receive this in the laboratory. So again, what are the different criteria for specimen rejection? Ito po yung mga yan. Ito lang yung mga examples, but hindi lang po ito yung lahat-lahat. Okay? Ito lang yung mga commonly encountered in the laboratory for specimen rejection. Policy for handling mislabeled specimen. Maling label to ha, yun yung mislabeled. Number 1, do not assume any information about the specimen. Like, hindi nyo dapat i-assume na, baka na mali lang yung letra. Mga ganon. Hindi po dapat, okay? Second, do not relabel an incorrectly labeled specimen. Okay? Kasi what if nagkamali pala talaga ng bigay sa inyo ng specimen, tas kayo, ang ginawa nyo lang is nirelabel nyo siya. So, parehas na kayong mali doon. Kaya dapat po, pag nakakita kayo na mislabeled yung specimen, huwag nyo na po siyang i-relabel. Okay? Third, do not discard the specimen until investigation is complete. Okay? Hanggat hindi nyo nare-resolve yung case ng mislabeled specimen na yun, wag nyo po munang itatapon yung specimen natin. Fourth, leave the specimen exactly as you received it. Put it in the proper storage area until errors are resolved. So, basta, ang gawin nyo na lang kapag naka-receive kayo ng mislabeled na specimen, like mali yung nakalagay na label dun sa specimen nyo, huwag nyo na lang siyang galawin. Okay? Then, fifth, notify floor, nursing station, or doctor's office, etc. of the problem and why it must be corrected for analysis to continue. So, kung sino man po yung nagbigay sa inyo ng specimen, dapat po i-notify nyo sila. Okay na, uy, parang merong mali dito sa pagkaka-label ng specimen natin. Like, mali yung date of birth or mali yung parang surname or kung ano mang pagkakamali dun sa label ng specimen, you should notify the person, whoever it is, na nagbigay po sa inyo ng specimen na yon. Okay? Sixth po is identify problem on specimen requisition with date, time, and your initials. Seventh is make person responsible for specimen collection participate in solution of the problem. Any action taken should be documented. Dapat kasi talaga, class, kapag naka-receive ng mislabeled na specimen, ang pinakauna nyong tatanungin is, of course, yung kumuha ng specimen na yon. Kasi malamang, kung siya ang kumuha ng specimen, siya ang nag-label ng specimen natin. And number 8, report all mislabeled specimen to the Quality Assurance Board. Hindi po kasi talaga pwede yung merong maling labeling dun sa specimen natin. It is actually a mortal sin na walang label at mislabeled yung specimen natin in medical technology. Okay? Ayan. So, yung mga tao dyan na mga walang label dyan. Okay, alam nyo na. Mortal sin yan sa mga medtech, ang walang labeled at mislabeled daw. Okay, hindi relationship ha, specimens tayo. Ayun po. So, this is the policy for handling mislabeled specimens. blood collection tubes. So, yung mga blood collection tubes natin, ito yung mga gagamitin nyo, class, para lalagyan ng dugo. Pag kumuha tayo ng blood sample sa vein, venipuncture, or capillary puncture, ito po yung mga blood collection tubes na pwede natin gamitin. Okay, first we have our tube additives. Tube additives are placed inside evacuated tubes and may function as an anticoagulant. So, pwede niyang prevent yung clotting. And also, it can be anti-glycolytic or it can prevent glycolysis, yung rupture ng glucose. Also, it can be a clot activator, pinapabilis yung clotting. Pwede ring anti-complement, anti-phagocytosis. Some tubes may contain thixotropic gel and antibiotic removing device or ARD. It really depends on the type of blood collection tube, kung ano yung laman niya. Then, order of draw must be followed to prevent invalid results due to bacterial contamination, tissue fluid contamination, and carryover of one additive or anticoagulant from one tube to another. So, meron pong mga different colors yung ating mga blood collection tube, didiscuss maya-maya, at meron pong proper way or order of draw. Like, ano bang kulay ang dapat mong unahin? Ganon. And specimens must be mixed through inversion. So, how to perform tube inversion correctly? So, yung tubes natin, for example, ito po, ganito yung itsura ng blood collection tube natin. A correct inversion is one complete turn of the wrist back and forth, just like this video. Again, class ha, ulitin natin. How do you correctly mix the tube additives? Ganyan po. Through inversion. Ganito po ang tamang inversion ng blood collection tubes. Ayan. Ganon ha, ganon lang. Dahan-dahan lang na hindi naman super maingat. Ayan. But hindi yung parang sinishake talaga siya na parang ano eh, no? Gigil na gigil i-shake. Ganyan lang po. A complete inversion is one complete turn of the wrist back and forth. 1, 2. So, yan. Yung nakita nyo sa video, dalawang inversions po yun. Okay, again. 1, 2. Ayan. Yan. Yung duration ng video na nakita nyo right now, dalawang inversions po yun. Okay? Then, what is the important things to know with regards to the blood collection tube? Number 1, know the color of the tube. Second one is the contents of that blood collection tube. Also know the number of inversions and what are the tests that you can perform with the blood collection tubes. No worry, discuss na natin siya. Okay, first here, we have the first anticoagulant. We have the EDTA or Edta, also known as the ethylene diamine tetraacetic acid. I repeat, Edta is the ethylene diamine tetraacetic acid. Edta po yun. Ang function na to is to prevent clotting by chelating calcium. This is the anticoagulant of choice for hematology cell counts or the CBC, cell morphology at HbA1c. I repeat, what is the anticoagulant of choice for CBC, cell morphology at HbA1c? That is Edta. Okay? So, kung ito pong mga test na ito ang marireceive nyo in the laboratory, dapat ang kukuhanan yung blood collection tube, dito nyo po yan ilalagay. Sa purple top. Okay? Purple po yan. Commonly available in lavender top or purple top tube as a liquid or spray-dried dipotassium Edta or K2 Edta or tripotassium Edta or K3 Edta. But the difference between the two is yung K2 Edta po natin is in plastic and is spray-dried, while the K3 Edta is glass is in liquid form naman. But definitely, the K2 and K3 Edta functions the same. Iba lang yung, kumbaga, parang lalagyan. Yung K2 Edta natin is made out of plastic, tas spray-dried form yung Edta sa loob. Tas yung K3 Edta natin is glass tubes at liquid form yung makikita nyo sa loob niya. Then we also have the pink top. The pink top or the pink spray dried, Edta rin naman po ang laman nito. This is good for ABO grouping, RH typing, antibody screening, and cross-matching. But in the laboratory, the pink top is not commonly used po. Ako personally, I haven't used pink top in the laboratory. Most of the time talaga, the purple top, ito yung mas common, the purple top or the lavender top, which contains the Edta, is enough para dito sa ABO, RH, antibody screening, at cross-matching. Hindi commonly found yung pink top, but it's good to know na meron pong ganito. We also have the white top collection tube. The white top or the white collection tube is for molecular diagnostics. Dito nyo po yan pwede ilagay. Okay, next natin here, we have the sodium citrate. Sodium citrate is the blue top, light blue top. Sodium citrate functions, prevents clotting. So, of course, this is an anticoagulant as well by chelating calcium, just the same with the Edta. It is available in blue top tubes containing 0.105 molar or 3.2% or the 3.8% sodium citrate. Basta po kapag light blue top, most of the time, sodium citrate na anticoagulant po yun. The blue top is used in coagulation studies. A good example of that is the prothrombin time and the APTT or the activated partial thromboplastin time because it prevents the labile clotting factors. So, si sodium citrate tube or the blue top, light blue top, is actually being used again commonly in coagulation studies such as PT at APTT. Then, coagulation studies require correct anticoagulant to blood ratio, thus containers should be adequately filled. Please do take note of this, marami pong nalilito dito. The correct anticoagulant to blood ratio is 1:9. I repeat, the correct anticoagulant to blood ratio is 1:9. Okay? Dapat po, ang anticoagulant ay mas konti in comparison with blood. But what if naman class, ang tinanong sa inyo, what is the correct blood to anticoagulant ratio? That's the time na ang sasagot nyo is 9:1. Okay? Basta ang tinatandaan ko dito, kapag ratio ng mga anticoagulant to blood, dapat po class mas konti yung anticoagulant natin in comparison with the blood. Okay? Marami pong nalilito dito. Again ha, ulitin natin, makinig kayo maigi. Kung medyo nagfa-fly-fly na ang ating attention, stop mo muna yung video, then break ka muna. But if not, ulitin natin, correct anticoagulant to blood ratio of the sodium citrate is 1:9. Mas konti po yung anticoagulant compared kay blood, di ba? Onti lang, 1. 1 lang yung anticoagulant niya. Tapos yung ratio ng blood is 9. But kung ang tinanong sa inyo class is blood to anticoagulant ratio, that's the time na ang isasagot nyo po is 9:1. Okay? O yan. Maraming nalilito dyan. Kaya dapat alam nyo yan. Again, the correct anticoagulant to blood ratio of sodium citrate is 1:9. Isipin nyo na lang, dapat laging mas konti ang anticoagulant compared sa blood nyo. Also, the sodium citrate is available in black top. So, si sodium citrate, meron ding black top yan. That is generally used in Westergren erythrocyte sedimentation rate or the ESR with an anticoagulant to blood ratio of 1:4 naman po. Again, pag yung mga black top na sodium citrate, ang anticoagulant to blood ratio is 1:4. Ganun pa rin, mas konti ang anticoagulant compared sa blood nyo. But kung ang tinanong sa inyo again dito, blood is to anticoagulant ratio of the black top, 4:1. But anticoagulant to blood ratio, 1:4. Basta dapat class, mas konti ang anticoagulant compared sa blood. Yan, maraming nagkakamaling students dyan. Kaya pinapaalalahanan ko na kayo. Also, if the citrate anticoagulant concentration is too high, the amount of calcium available during the testing phase is decreased and the resulting time to clot formation is prolonged. Underfilled sodium citrate tube is incorrect. So, dapat po tama po yung blood is to anticoagulant ratio ng ating sodium citrate because ginagamit nga po itong sodium citrate na ito commonly sa coagulation studies. At kung mali, yung blood clotting or yung clot formation na mangyayari inside the sodium citrate room, magkakaroon na ng erroneous results. Dapat po tamang-tama lang yung ratio ng anticoagulant tsaka sa blood as well as yung volume ng ating blood. The underfilled sodium citrate tube is mechanism of specimen rejection. Hindi na po pwede yan. Dapat tamang-tama lang yung dami ng ratio at yung volume, of course, ng blood sa sodium citrate. Okay, next natin here we have your heparin. It is available in the green top as lithium heparin or sodium heparin. So, same lang yon, lithium tsaka sodium heparin. Mechanism niyan is almost the same. Iba lang yung parang pinaka-foundation niya, but it is available in green top pa rin naman. Then, function niya is prevents clotting by binding to thrombin. So, di ba si sodium citrate tsaka si Edta, it chelates calcium para mag-prevent ng clotting. But in the heparin, it prevents clotting by binding to the thrombin part of the blood. It does not affect levels of calcium. So, it is the preferred anticoagulant for plasma potassium measurement, arterial blood gas, and ammonia determination, and other routine chemistry tests. It is used especially when a chemistry test is stat. And please do take note of this. Do not use lithium heparin for lithium and folate determination. So, kung lithium kasi yung gusto nating i-test, of course, makaka-affect kung lithium heparin po yung gagamitin nyo. Kasi may lithium siya. So, in that case, gamit ka na lang ng ibang heparin or gamit ka ng sodium heparin. And also, please do take note that do not use sodium heparin, of course, for sodium determination kasi nga may sodium po. Then, but it can be used for trace elements such as the lead toxicology testing. Then, sodium heparin is the injectable form used for anticoagulant therapy. Then, take note na rin po ito, heparin is a naturally occurring anticoagulant that prevents the formation and extension of blood clots. Heparin does not break down clots that have already formed, unlike tissue plasminogen activator, but it allows fibrinolysis to work normally to break down clots. So, inside our body, of course, hindi po nagka-clot yung dugo natin normally. At ang reason po niyan is the presence of heparin. Okay? That is our natural anticoagulant inside our bodies. Heparin po yun. Kaya hindi tayo nagkakaroon ng blood clotting sa loob ng katawan natin is because again of the presence of the naturally occurring anticoagulant known as heparin. Okay, next natin here we have the sodium fluoride. Sodium fluoride is not an anticoagulant, so it does not prevent clotting. However, it is a preservative with anti-glycolytic property. So, it prevents glycolysis of glucose for up to 72 hours. That's why the sodium fluoride is actually this anticoagulant or the additive of choice for glucose determination. Because again, it prevents glycolysis or the rupture of glucose. Then, it is available in gray top po. Yung mga gray top natin, sodium fluoride po ang laman yan. Again ha, si sodium fluoride po ay hindi anticoagulant. Hindi niya nape-prevent yung clotting. However, it is a good anti-glycolytic agent. It prevents glycolysis of glucose for up to 72 hours. That's why kung kayo po ay tatanungin ano yung best collection tube kapag glucose determination, makabasa kayo ng glucose doon sa testing or yung request nyo. Pinaka-the best na gamitin nyo dyan, sodium fluoride po. And then, if gray top tube is labeled with sodium fluoride only, then it will yield a serum sample. Kasi nga, di ba, si sodium fluoride ay hindi anticoagulant. So, serum lang. Yung serum kasi class is the liquid portion of the blood na merong clot, So, since na hindi napipigilan ng sodium fluoride ang clotting, serum ang ma-yield niya. But if plasma sample is needed, an anticoagulant must be present in the form of potassium oxalate, which is more common, or sodium EDTA. But both anticoagulants prevent clotting by binding to calcium. Again ha, ang ating sodium fluoride is not an anticoagulant. It does not prevent clotting. That's why if you will be using sodium fluoride only, the gray top, it will yield a serum sample kasi magkakaroon ng clotting dyan. Then, please do take note as well that sodium fluoride destroys our enzymes. Therefore, do not use this when performing enzymatic tests. Okay, we also have the plain and then the non-additive tubes. This is available in red top. Yan, kulay red. It has no anticoagulant is present, so blood collected from these tube clots. So, wala nga kasing anticoagulant, so magka-clot po. Therefore, it yields a serum sample after a complete clotting of 60 minutes. So, ang tagal, di ba? Almost 1 hour ka maghihintay hanggang sa mag-clot yung dugo. And this can be used for most chemistry, blood bank, and immunology assays. So, sa clinical chemistry section in the laboratory, most of the time, ang ginagamit doon is the red top or the plain tubes. Kasi wala po siyang kahit ano, as in, ito lang. Walang laman yan. Plain lang po siya. It does not contain any additive. So, if you will be using this, walang anticoagulant, walang kahit ano, serum sample ang mag-yield mo ngayon. We also have your separator tubes. These are tubes with thixotropic gel, which is made out of silica, polyester, and acrylic gels are available in the market, which separates the liquid portion and cells of the blood. Then, during centrifugation, blood is forced into a thixotropic gel material located at the base of the tube. The gel undergoes a temporary change in viscosity during centrifugation and lodges between the packed cells and the top serum layer. Silica and polyester gels are not recommended for therapeutic drug monitoring because gels may be absorbed certain drugs which may falsely lower results. So, ito po siya. So, this is the physical gel. Yung may thixotropic gel. This is available in gold color top. Color gold yung top niyan. So, yan po. Pwede kayong maglagay ng blood dyan. Ayan. Ito yung gel class, o, nasa baba. Pansinin ha, nasa baba. Pag naglagay kayo ng blood dyan, o, nandito na yung blood. Then, paglagay mo dyan ng ating blood, pwede mo na po yung i-centrifuge. So, isi-centrifuge natin yan. Then, iikot yan na mabilis na mabilis. Then, paglabas class ng ating sample after centrifugation using the thixotropic gel, maghihiwalay na po yung cell-free liquid natin, yung serum natin, nandito siya sa taas. Yung nasa gitna is the thixotropic gel, yung dilaw. At yung nasa baba is yung red cell nyo. Okay? Katulad po nito, ganito ang itsura pag naglagay kayo ng dugo. Ayan, diba? Dalawang layer lang. Ito, itong pula, ito yung dugo, tapos ito yung thixotropic gel sa baba. Then, after centrifugation, magiging ganito na po ang itsura niyan. Nasa baba, yung formed elements such as the red cell, nasa gitna yung thixotropic gel, at nasa taas ngayon yung serum. That is the separator gel. Ganyan po ang nangyayari kapag thixotropic gel po ang ginamit mo. Okay, so we also have the royal blue top. The royal blue top is available in spray-coated silica clot activator for serum or with K2 Edta or sodium. Heparin for plasma. It is used for toxicology, trace metals, and nutritional analysis. This is the royal blue top. We also have the tan top, which contains K2 Edta for lead determination naman po ang ating tan top. Yan po. Then we also have the yellow top. The yellow top actually has two types. First is the yellow top with acid citrate dextrose or ACD. This is an RBC preservative used for cellular studies in blood bank, human leukocyte antigen or HLA phenotyping, and DNA and paternity testing. That is ACD po, okay? Ang tinatandaan ko dito kay ACD, yung yellow top with ACD is yung regarding DNA or paternity testing. And then po, meron din po tayo actually na yellow top, which is the sterile yellow top with sodium polyurethyl sulfonate or SPS. SPS is an anticoagulant used for blood culture. It binds to calcium to prevent clotting of blood, and it is an anti-complement, anti-phagocytosis, and it prevents the action of certain antibiotics which may contain ARD as well. That is the SPS. So, si sterile yellow top with SPS is mainly used class for blood culture or pagpapatubo po ng bacteria in the blood. Okay? So, pwede pong ganyan yon. Yellow top yun. Sterile po yan dapat. Sterile. Dapat walang kahit anong microorganism dyan. Kasi nga po, ang ating mga sterile yellow top with SPS is used primarily for blood culture or yung pagpapatubo po ng bacteria sa blood. Yan po. At ito nga again, yung kanyang mga function. Okay. Order of draw. So, yun, na-discuss na natin yung mga different colors ng ating mga blood collection tube, as well as anong mga test ang pwede sa kanya at ano yung composition niya. So, dapat kabisado nyo yun, ha? Ngayon, order of draw. Pag po tayo ay magko-collect ng sample, especially through evacuated tube system or yung ETS, yung magpapalit-palit ka nung blood collection tube, there is a proper order of draw as mentioned earlier to prevent contamination and carry over nung ating mga blood additives or the anticoagulants. Okay? Meron pong tamang pagkakasunod-sunod to, okay? So first we have here blood cultures or with the SPS, yung yellow top. Okay? Next, after the yellow top, ang dapat na lalagyan mo ngayon is the citrated tube or the light blue. Next, SST or the serum separator tubes. Okay? Next tube niyan, kapag nakapaglagay ka na ng blood dyan, susunod mo na dapat lagyan ay yung serum tube or red. Okay? After the red tube, dito tayo sa heparin tube which is green. Ayan. Then after the green tube, we have the lavender or the purple top. And then the last one na dapat mong lagyan if ever na umabot ka sa point na to is yung gray top. Yung gray top, di ba? That is sodium fluoride. Ayan. Again, what is the correct order of draw of our blood specimens to prevent contamination and carry over? Pwede nyong kabisaduhin ang mnemonic na Yoko bumagsak self. Ready ka na, go lang ng go. Ano po ang ibig niyang sabihin? Yoko, letter Y, yellow. Bumagsak, wag naman, pero nandito na yung term. Letter B, blue. Self, SST. R, ready for red. G for green. Yung lang, letter L, lavender. At yung letter G na isa pa is gray. So, dun sa ating module activity, I have instructed you guys to have your own mnemonic. So, kayo na bahala kung anong mnemonic ang pwede nyong gamitin para makabisado nyo po yung order of draw of our blood collection tubes. Dapat po ganito yung pagkakasunod-sunod nung paglalagay nyo ng dugo sa mga different collection tubes natin. Hindi naman common no, na lahat yan kailangan nyo lagyan. Hindi po ganon. Minsan lang meron 3 or 2 dito na kailangan nyong lagyan. But definitely, kahit ilan man yan na blood collection tube na gagamitin nyo, you should follow the order of draw lagi. Kailangan unang-una talaga natin dyan ay yung ating yellow top, yung blood culture tubes natin, yung SPS. And then, aside from that, na kailangan kabisado ninyo, class, yung order of draw, dapat kabisado nyo rin po, of course, is yung inversions natin. Ang ating mga blood culture tubes, yung SPS, it should be mixed. Yung inversions niya, 8 to 10 times. The citrated tube, the light blue top, is 3 to 4 times. Ang ating mga red top, ang red top natin, 5 times kung plastic po yung gamit. Kapag glass naman, wala pong inversion. Hindi nyo na siya kailangang i-mix. Then, the heparin tube is 8 to 10 times as well as the lavender top, yung Edta, 8 to 10 times. At yung fluoride tube natin, yung gray top, is 8 to 10 times din po yung ating inversion. So, yan. Dapat kabisado nyo po yan. So, we are now done with the collection of the blood samples as well as the different blood collection tubes. We will now be discussing about collection of other body fluids. So, in our body, hindi lang naman blood ang pwede nating kuhanin. Meron din pa tayong mga other body fluids that we can test to check for diseases. First is urine. Urine is the second most common specimen received in the laboratory. Yung first kasi class is of course yung blood. But the second most common specimen received in the lab is of course yung urine po natin. The normal range, 24 hours, that is yung normal output ng urine natin in our body within 24 hours is 600 to 2,000 ml of urine per day. Then, an average lang is 1,200 to 1,500 ml of urine per day, yung normal daily output ng isang adult. Then, the night urine output is less than 400 ml. Then, the night-to-day ratio is 1:2 to 1:3. So, of course, mas marami tayong iniihi sa day or sa umaga or sa hapon because sa gabi naman, most of us naman is tulog. That's why 1:2 to 1:3 yung normal night-to-day ratio ng urine output natin. Then, the container capacity for urinalysis is 50 ml. So, once na magko-collect ang isang pasyente ng urine sample, dapat yung kanyang specimen container should have a maximum capacity of 50 ml. Okay? Then, the required for routine urinalysis is 10 to 15 ml with an average of 12 ml. So, kung napansin nyo po na ang urine natin is less than 12 or 10 ml, yung urine na binigay sa inyo, that's the time na pwede nyong sabihin sa pasyente na, ma'am, pwede po ba mag-collect tayo ulit at dapat po mas marami. Kasi po, again, the required for routine urinalysis is an average of 10 to 15 ml or 12 ml nga po. Okay, so dapat ito yung parang pinaka-minimum na dami ng ihe na kailangang ipasa po sa inyo ng isang pasyente so that you can perform routine urinalysis properly. And then the most ideal specimen for the urinalysis is first morning midstream clean catch. So, first morning, ito daw po yung unang ihi sa umaga. Okay, yun po yung ibig sabihin ng first morning. Okay, another body fluid inside our body is cerebrospinal fluid or CSF. The mode of collection of CSF is lumbar puncture in between the L3 and L4 or L4 and L5 yung sa spine po natin. So, ito yung spine. Yung spine natin na yan, meron yung parang spaces in between. Diba yun yung mga buto-buto sa spine natin? Meron po mga spaces yan in between. Tapos, meron designation yan. May number kasi yan, class. Yung sa spine nyo, yung buto nyo sa spine. Meron pong designated number yan, which is, meron dyan yung lumbar. Yung lumbar area ng ating spine, meron dyan L1, L2, L3, L4, L5, ganon. Then, kukuha po kayo ng CSF natin, CSF sample, in between L3 and L4 or L4 and L5. So, ito nga po, kung titignan nyo dito sa structure natin ng spine nyo, this is the L4 and L5, tapos meron niyang space in between at dun po tutusok yung doctor. Please do take note na hindi po medtech ang nagko-collect ng cerebrospinal fluid, okay? We are not trained to collect lumbar puncture. Okay? So, tayo lang po yung taga-process niyan. Most of the time, the lumbar puncture is being performed by doctors po. Hindi po tayo trained to perform lumbar puncture. Okay? Tayo lang po yung nagtitest. But, then again, as medtechs, it is good to know at dapat alam natin kung ano yung mode of collection ng CSF na ito. Kasi nga po, tayo yung magtitest niyan. Then, order of tube collection and storage. So, kung sa blood, merong order of draw ng mga different blood collection tube, yung kulay niya nga, diba, yellow, blue, etc. Dito po sa ating CSF ay meron din po siyang fina-follow na order of tube collection and of course, its storage. Si lumbar puncture po kasi ito, ayan, once na si doctor ay kumuha dyan ng CSF, the doctor should actually collect a minimum of 3 different tubes po. Okay? 3 to 4 tubes. The first tube that is being collected is for chemistry and serology at ang storage po niyan ay frozen. Ang acronym nga na ginagamit ko dyan ay CSF. I repeat. Si doctor daw po, pag nag-perform ng lumbar puncture, like kumuha ng cerebrospinal fluid sa isang pasyente, most commonly, lumbar puncture, magko-collect si doctor niya ng at least or minimum of 3 different tubes. Ayan o, 1, 2, 3. Itong tatlong different tubes na yan, meron pong specific designations yan in the laboratory. Okay? Hindi po pwedeng pagpali-palitin to. Like yung tube 1, dapat po, diretso po yan sa chemistry and serology. At kung i-store nyo po yung CSF sample in the tube 1, it should be again frozen. So, chemistry, serology, frozen, CSF. Ayan o. Letter C, letter S, at letter F. That is the first tube. The second tube should be directed to microbiology. Microbiology samples should be kept at room temperature. I repeat, the second tube collected in lumbar puncture for CSF should be directed to microbiology section and it should be stored at room temperature. M, micro, R, room, T, temp, MRT. Okay, yan. Para makabisado nyo, gawa kayo ng mga acronyms. Again, saan nga daw po ulit nilalagay ang second tube na nakuha sa lumbar puncture? That is MRT, microbiology, room temperature. Then, what about the third tube that is collected? Diba sabi nga ni ma'am kanina, more commonly, ang lumbar puncture should have a minimum of 3 tubes collected. O, meron na tayong una, napunta yan sa chemistry, serology, tapos ifo-frozen natin for storage. Second tube natin again is in the microbiology section, which is stored in room temperature. The last one, we have HR. The third tube should be directed to the hematology department and it should be refrigerated po. Again, the third tube, yung pangatlong tube po na nakolect through lumbar puncture should be directed to hematology and it should be refrigerated. And then ito po optional. Optional lang naman, the doctor can actually collect a fourth tube. This is for additional testing. But definitely, once a lumbar puncture is requested, the doctor should collect a minimum of 3 different tubes. Again ha, huwag kalilimutan. At dapat po ha, tama yung order of tube collection natin. Hindi po pwedeng pagpali-palitin to, yung pagkakasunod-sunod. Okay? Dapat po ganyan. Again, the first tube should be directed to CSF, chemistry, serology, frozen. The second one should be directed to microbiology section and it should be kept at room temperature, MRT. Then the third one should be directed to the hematology department and it should be refrigerated when stored. And then again, the fourth tube is optional lang naman na to collect. This is for additional testing. Then ito nga po yung mga different tests na kaya nating i-perform sa mga different tubes ng CSF. Again, number 1, yung chemistry such as the glucose and the protein as well as in serology and frozen, diba, CSF. The second tube is in the microbiology lab. Microbiology, pwede tayo mag-perform ng Grimes stain, AFB, India ink, bacterial culture, fungal culture, and culture for tuberculosis. So, pwede po yan. Mga test na ito ay pine-perform in microbiology lab. The third one is the total cell count and differential count. This is performed under hematology. And yung fourth one, yung additional nga po, optional, this can be directed to cytology, immunology, and for additional testing na kailangan for the sample. Question, class. What if, ma'am, isang tube lang po yung nakolekt natin? Diba kasi sabi ni ma'am kanina, requirement sa lumbar puncture, minimum of 3. Eh what if wala wala tayong magawa, isa lang talaga yung nakolekt ni doctor na CSF sample. Isang tube lang yung nakolekt niya. So this is the proper pagkakasunod-sunod naman ng departments if isang tube lang po ang nakolekt. Please take note, this is a recall question in the board exam. Okay? What if 1 tube of CSF only was collected instead of 3? Diba? Minimum is 3. Eh, isa lang yung nakolekt. Paano yung tamang pagkakasunod-sunod ngayon? Pag ganun po ang nangyari, dapat po ganito yung tamang pagkakasunod-sunod. Una, ilalagay niyo yan sa microbiology. Second is hematology. And then, the last one is chem or serology. Di ba in the normal process, ang first tube dapat nasa chemistry at serology. But what if it happens nga na isang tube lang yung na-collect? Dapat po sa microbiology lab nyo po siya agad idiretso to prevent contamination and yung mga presence ng bacteria. Like kapag kukuha kasi ng sample, minsan sa tube mako-contaminate siya. So, dapat po, kapag isang tube lang ang na-collect, diretso po sa micro yan. Okay? Dito kasi kay microbiology, dito tayo nagpapatubo ng mga bacteria or viruses or fungi. So, dapat po, walang masyadong contamination yung sample natin. Kaya, kung isang tube lang na-collect, again, CSF, una nyo idala yan sa micro, sa hema, tapos sa chem-sero. Take note ha, recall question po yan sa board exam. And then, mode of collection of other body fluids. For the pericardial fluid, the mode of collection is through pericardiocentesis. Nandun naman na yung term. Diba? Pericardy. Tapos, pericardiocentesis ang mode of collection yan. The pleural fluid class is through thoracentesis. Yun po yung pangalan ng mode of collection. Kung sa CSF ay lumbar puncture, kay pleural fluid, tsaka pericardial fluid, ito yung mga pangalan nila. Then, the peritoneal, otherwise known as ascitic fluid, paki-take note po, recall question din. Peritoneal or ascitic fluid mode of collection is through peritoneucentesis. Yan. Again, peritoneal fluid, also known as ascitic fluid, is through peritoneucentesis. Okay, next is centrifugation. Centrifuge, di ba, na-describe na natin siya in the previous module. So, centrifugation, then after centrifugation of a blood sample, the following layers are observed. Okay, di ba, ito yung whole blood, and then after centrifugation, maghihiwa-hiwalay po niyan yung components ng blood natin. Nasa baba yung erythrocytes or the red cell, nasa gitna yung buffy coat which contains the white blood cells and the platelets, at yung nasa taas is the plasma or serum, the liquid portion of the blood. Ganyan po ha ang centrifugation of blood. Then, kanina binabanggit na natin to, serum tsaka si plasma. Serum and plasma is both the liquid portion of the blood. Ito pong kulay dilaw na ito, yung nasa taas niya, this is the liquid portion of the blood known as serum or plasma. But, class, magkaiba po ang serum tsaka si plasma. Okay? They are not synonymous. They are entirely different things. Although parehas silang liquid portion of the blood, meron po silang major differences. At ito nga po yun. The definition of a serum is the liquid or the cell-free part of the blood after centrifugation or after coagulation. Okay? So again, pag sinabi po nating serum, there is a presence of blood clotting or coagulation. Okay? So, kapag po nag-yield kayo ng isang sample na merong clot, yung liquid portion po na yun, ang tawag po dun ay serum. Again, serum is the liquid part of the blood after coagulation. While the plasma class naman is the liquid part of the blood as well. So, same lang naman, the liquid portion. However, this has been treated with an anticoagulant. Again, the liquid portion of the blood that has been treated with an anticoagulant. So, kung merong anticoagulant, of course, walang clot yung blood nyo ngayon. That is, again, your plasma. Major composition of the serum. The serum is composed of water, albumin, globulins, amino acids, hormones, enzymes, NPNs, gases higher in TGF-beta, and mga interleukins. But please do take note that in a serum, the fibrinogen is absent. I repeat, in a serum, fibrinogen is absent. While in the plasma, depending on what anticoagulant it is used, it has lower calcium and magnesium in EDTA and citrate and plasma. Other contents are the same in serum. So, same lang naman. However, fibrinogen is present in plasma. Okay? So, yun ang i-take note nyo dito. Again, yung serum natin, wala daw fibrinogen. Ang plasma is meron pong fibrinogen. Then, volume in vivo meaning inside of the body. Serum is not found in vivo. It can be obtained by allowing clot formation. So, sa loob ng katawan natin, in vivo, Yung in vivo ha, again, ang ibig sabihin po ng in vivo ay sa loob ng katawan. Serum is not found inside the body because again, the serum is the liquid portion of the blood after blood clotting. At wala pong clot sa loob ng katawan natin, not unless mag-cause yan ng heart attack or patay na tayo. But definitely, in a normal, healthy individual, wala pong blood clotting na nangyayari sa loob ng katawan natin. Okay, so serum is not found inside the body. However, the plasma is the 55% of the total blood volume. If you can recall, as mentioned earlier, there is a naturally occurring anticoagulant inside of our body, and that is, ano nga daw po ulit ang naturally occurring anticoagulant inside the body? That is heparin. Diba? Ang heparin ang naturally occurring anticoagulant inside the body. That's why ang nasa loob po ng katawan natin is actually the plasma. Kasi nga po may anticoagulant yung blood natin. And then the use of anticoagulants, of course, sa serum, none. Kaya nga po nagka-clot kasi walang anticoagulant. So, serum, wala pong anticoagulants yan. At yung mga plasma samples natin is with anticoagulants. So, most definitely, kapag kayo po ay gumamit ng mga anticoagulated tubes natin, such as EDTA, sodium citrate, etc., ang mai-yield nyo po dyan na liquid portion is plasma po ang tawag doon. But for those blood collection tubes that does not contain any anticoagulants, such as the red top, yung plain additive or non-additive tubes, mai-yield nyo po doon na liquid portion is of course the serum. So, also, explain ko lang maigi class bakit sa serum is absent si fibrinogen at si plasma, merong fibrinogen. Ito po yung rationale behind that. Fibrinogen is a protein, specifically a clotting factor known as factor 1, that is essential for proper blood clot formation. Okay? So, si fibrinogen, di ba, ang sabi, sa serum, absent siya. Kasi po, ang nangyayari, once this portion of the blood clots, the blood cells is in the fibrin clot or the fibrinogen. Kumbaga, yung fibrinogen na natatagpuan sa whole blood, mapupunta siya ngayon dito sa clot na ito. Mako-concentrate siya dito sa pulang area. That's why in the serum or the liquid portion of the blood, wala ng fibrinogen. Kasi nga po again, the fibrinogen, nag-merge po siya dito sa clot natin. Okay? While the plasma naman, since wala naman pong clotting na nangyayari dyan because of the presence of anticoagulants, it contains now the fibrinogen. Kasi nga po, wala namang clotting dito. At ito nga po yung reason niyan. Okay, thank you for listening. If you have any questions or clarifications, please do not hesitate to contact me at this email and through my messenger.